This is my presentation by Stacey Thorne, produced in February 2022 for Unit 17, Human Immunity. These are the topics that I will cover. Infection and transmission. Infections can be described as an invasion of the body by microorganisms like bacteria, which is a single-cell organism, UTI, TB, cellulitis. Parasitic infections are caused by mosquito bites and malaria. Fungi are normal skin diseases like athlete's foot, but can affect the nervous system and the lungs too. Viruses are smaller than bacteria, and as they are not alive, they must find a host in order to reproduce and survive. For example, the common cold and COVID. There are four main methods of transmission for infection: direct, as in person to person, touching, kissing, coughing or sneezing, and there is also animal to person and in vitro. Indirect, sneeze and leave the residue behind, and the next person to pass and touch the item can become infected. A cold virus can survive on surfaces indoors for several days, but its ability to transmit infection decreases over time. Insect bites are also transmitted infection via carriers known as vectors. Ticks and mosquitoes are well known for this. Contaminated food can transfer E. coli via uncooked food and unwashed salads, for examples, and this can make a person feel very unwell. There are three main lines of defence which protect the body from pathogens entering the body or eliminating them before they do. The first consists of physical and chemical barriers. The skin is the largest organ in the body, and the outer layer is called the epidermis, which provides a waterproof cover and prevents pathogen from entering by mechanical barrier. The skin is part of the intergorgamental system. This prevents chemical irritants and toxins entering the body. If the skin is cut, it can allow pathogens into the body directly, so the body will react to protect itself from forming a crust over the cut while the internal structures repair itself. Most of the defences are performed automatically. The skin has a salty taste, and as such it helps to make sure that it's not a good environment for any breeding bacteria. Physical and chemical barriers. The mucous membranes are used to trap and move pathogens away and out of the body. A pathogen can enter the body through different cavities, like the nose, which is covered on the inside with a sticky mucus lining, and the pathogen can be removed by blowing the nose or by the cilia that line the airway, and these will expel the particles away from the lungs. Although the membrane functions as a defence, it still allows nutrients to pass through while trying to filter out the pathogens and allergens. The site of the body cavities can be of a greater risk of infection due to the internal and external sites meeting each other. The female urinary tract system has barriers in place to protect it, but the female urethra is short, and so it's easy for bacteria to enter the bladder. But the flushing pattern of urine will normally flush out the bacteria at the same time, and this also applies to males. The gastrointestinal tract contains stomach acid, bile, intestinal secretions, pancreatic enzymes, which also help provide a chemical barrier against infections. Peristalsis helps to remove harmful bacteria as the chyme passes through the digestive system. The stomach acid is too low for the pH in the stomach acid has a low pH for most bacteria to survive. Inflammatory response. The second line of defence, inflammatory response of increased white blood cells at the site of infection. The first and second are both non-specific and innate. The immune system response to danger at the cellular level is inflammation. Blood cells around the site of infection dilate, which increase the inflammation. There are gaps created in the cell walls to allow large blood cells to pass through and increase the blood flow, and to allow the body to have a stronger response. Certain cells will carry large supplies of protein to fuel the response. Once a chemical alert is sent out to attract the macrophages, they carry out the job to absorb the bacteria and the phagocytes. The site of infection may feel warm to touch due to the extra blood sites and proteins that gravitate to it. It's often painful as mechanical pressure to be applied to the nervous system. White blood cells consist of phagocytes and lyosomes. Phagocytosis is the term used to destroy and damage foreign cells or eating cells. Phagocytes bind to the pathogen and the enzymes inside to break down the pathogen to destroy it. Lyosomes, on the other hand, scan the protein on the surface of the pathogen known as antigens. and sees it as a foreign body to produce antibodies to combat it. So when the phyosome and lyosome become one, this is known as phyolosome. The monocytes will change into macrophages and will then fix onto foreign cells. Macrophages are a variation of cryotine cells and is particularly important in protecting the body from microbacterial killing by infection by killing and blocking pathogens. Neutrophils are the first to arrive at the site, which release more cryotones to attract more at the site. They attach themselves to the wall of the vessels and prevent the pathogens entering the bloodstream by blocking it. They can move around, known as chemotaxis, so they can travel to the needed sites. Monocytes become macrophages to carry out phytosis process. Antigens are in different molecules, and they are responsible for alerting the body that they are being attacked. Pathogens need an antigen to enter the body. Neutrophils do not have antigens, but macrophages do. Cryotones, smaller complex proteins that travel around the body in the bloodstream, remain inactive until a pathogen wakes them up. Once they are active, a chain reaction takes place. Phytocells will remove the object and start inflammation, which in turn attracts more phytocytes and more proteins that attack the cell membrane of the pathogen, and this creates it to rupture. They make the immune system more effective by signaling and mediating inflammation and immunity. Immunoglobulins are proteins that are bound to antigens and antibodies. They have many functions in the body, from recruiting of immune cells, removing of antigens, and activating other mast cells, to name a few. There are up to 4 chains and arranged in a Y shape. There are several types. The IgE is the largest molecule, but only presents in low levels in healthy people. If you have too much IgE, then this can cause an allergic reaction like hay fever. IgG is the most common immunoglobulin and stimulates direct attacks on foreign particles. It's the only one transferable from mother to child to give the fetus some basic protection. IMM has a different structure to the rest that we can see on the slide, and will be the first synthesized reaction for an antibody response. Lymphocytes can be found in the lymphatic tissue, and they are B cells and T cells. The T cells mature in the thymus gland and aid in the destruction of the problem cells and damaged cells and pathogens. 75% helper T cells, which relieve lymphokines, will be stimulated by other T cells to grow and attach. T cells functions signaling for growth and attract the B cells. B cells' function is produce antibodies, and to produce antibodies when they are stimulated to do so. Maturation is conducted in the bone marrow. Plasma cells are B cells that will secrete a single antibody direct into the circulatory system. Memory B cells can store information for further attacks and are stored in the lymph node ready. Self-recognition and tolerance of antigens. Antigens are molecules only found on all cells. They will only let non-self antigens be attacked. The immune system has a self-tolerant system and will not attack antigens that have the MCH1 tag with it, as it has read this as it is a self. If a non-self antigen is located, then the B cells will remember it for next time, and the B and T cells will respond. There is no standard response as all foreign antigens are different. Major histocomplexities, MCH1, are often on the surface of nucleated cells. As the immune system has a built-in self-tolerance, it will not attack these. There are also MCH2, which are like MCH1s, but they are not present on all nucleated cells. There may be a case where B and T cells become activated and the self-antigens and cause autoimmune disease. There is no reason why this happens. This hypersensitivity, this happens to self-antigens that cannot escape, and it is caused by repeated exposure to the same antigen. There are many different types of autoimmune system, but it's unclear why this happens in the first place. Autoimmune. When self-tolerance fails, then the response of the adaptive immune system to self-antigens make the body turn on healthy cells. There are several symptoms: muscle ache, low fever, fatigue, pain, redness, swelling and inflammation, to name a few. Triggers are drugs, chemical irritants, bacteria and virus. Environmental irritants can play their part. Multiple sclerosis is a condition that affects your brain and spinal cord. In MS, the coating that protects your nerve, the myelin, is damaged. This causes a range of symptoms like blurred vision and problems on how we think and feel. When the sheath is damaged, the signal travelling along is slowed and disrupted, and this causes the problem. You are 2 to 3 times more likely to develop MS if you're a woman over a man. If there is a family history, there is a higher probability. Most people are diagnosed with either indicatory relapse or gradual progression of the disease and symptoms. We can also look at rheumatoid arthritis as another disease when it comes to the system attacking the cells around the joints, normally making them painful and stiff. It is believed that there is a higher risk if you're a woman, smoke or have a family history. There is no cure, just ways in which to live with it, and this can include physiotherapy, surgery and medication too. The immune system is particularly good at what it does, which creates a problem when an organ is transplanted, as it sees it's a foreign agent. To reduce this, then there is tissue typing. This reduces the risk of rejection. Medication containing monoclonal antibodies are needed to suppress the T cells which cause rejection before and after surgery. If you look at the slide, you can clearly see the reasons for rejection. It is common that most people suffer some degree of rejection, and it is normal. Chronic rejection is a long-term effect that can happen years after transplant. Acquired immunity can be shown in the 4 main categories. Natural active immunity will be created once exposed to a particular pathogen. The B cells will create the antibodies to detect and kill the pathogen and have the skill to remember the pathogen and the response for the next time. Artificial induced active immunity is created when the foreign pathogen is introduced into the body to generate a response and creates the antibodies it needs in advance. This is normally by way of vaccine. B cells remember the protocol in the same way as they did before. This means if a person naturally encounters the pathogen, then the immune system will be ready to spring into action and the effects will be less on the body, will be able to fight them off before the symptoms really develop. This is called immunology memory. Passive immunity is when the antibodies are passed from one person to another. In most cases, this is pre- and postnatal. In such, a mother can pass on an immunity to an unborn child. This can provide up to 6 months' worth of protection. Artificially induced passive immunity. This is via blood transfusion injections, and the antibodies have been made by another person and are artificially introduced to the body. As the body is not making its own antibodies, they will then normally only last a few weeks before they break down and will need to be replenished. The main purpose for vaccination is for your body to create a protocol for when it encounters a pathogen. The vaccine will contain a small amount of the pathogen for the body to create antibodies and remember them for when and if they are needed. The vaccines can contain dead pathogen, toxins produced by the pathogen, harmless particles of the pathogen or live pathogens, but are altered to make it harmless. So these will stimulate the body ready to create the antibodies. So when the white cells can rapidly reproduce the antibodies to destroy it, and hopefully you will never have symptoms. In the primary response, the first time the pathogen is encountered, the B lymphocytes will identify the antigens and the plasma cells will produce the relevant antibodies. And the memory cells are created ready. But this takes time, which is why we often see more symptoms. The secondary response is when the body already has had contact with the pathogen and the memory cells can create the right antibody to destroy it. This is conducted a lot faster with a higher number of antibodies created to flood the system and deal with the foreign pathogen. Often with this response there is little systems as the body is very efficient. Often with this response there is very little effects on the system as the body is very efficient. The idea behind immunology memory is shown by the secondary response, so we can see the benefits behind vaccination, that they make the body ready to fight the pathogen in a speedy and effective way that has minor impact on the body's ability to continue as normal. Measles is a highly contagious disease and can lead to serious complications as pneumonia and even death. The figures speak for themselves. In 1967 there were 407,000 reported cases of measles. This was before the first vaccine was administered. Then it dropped off again after the MMR was introduced in 1988, and then the figures dropped again in 1988 and in 1998. And as for the 2000s, the figures went down to 698, according to the figures from the Office of National Statistics. There has been a drop in number of children that are being given the vaccine, and any drop can be potential worry and can cause an outbreak. Since COVID outbreak in March 2020, there has been a decrease in the uptake of the vaccine. It means that more than 1 in 10 children aged 5 are not up to date with their second dose of the MMR vaccine. The World Health Organization, WHO, says 95% of children need to be vaccinated in order to keep measles away. This could be down to several reasons, from anti-vaxxers to being able to access healthcare to parents thinking it's not needed if the children are not mixing and staying at home. Previously, when figures dropped, it was after an article in The Lancet in 1998 claiming there was links with MMR to autism. Yet this has been disproved, yet it's still worrying to see the fall in the uptake. There are also financial implications for the vaccine, for vaccinations, and that from a cost point of view, it is cheaper and more effective to vaccinate than to deal with the disease if they take hold. Herd immunity is a concept that if enough people have a certain immunity, then it can be used to slow down the spread and help protect those that cannot be vaccinated. And it is less likely that the disease can spread. Due to the transmission rate of different diseases, there is no one scenario that fits all. In principle, it makes sense that if a person is surrounded by vaccinated people, then the disease cannot spread as it has nowhere to go. There are a few issues that if there is a break in the vaccination, then there becomes a break in the herd, and often new cases are seen. Then there is the issue that you can become infected before the body has a chance to build up immunity, and there are many pathogens that present different antigens and that can mutate like flu, and this causes antigen variability, making it more difficult to find the right response. Transmission and severity of the microbes in a pathogen affect the threshold vaccination necessary to create the herd immunity, as some can transmit more freely than others, and there are some demographics that are more susceptible to certain pathogens than others. We also need to consider the way in which things spread and how far they can reach and who they can affect. From recent times with SARS-CoV, this was a worldwide pandemic, since we are now in a global community. So it's become harder to contain and not just isolate one area. But we also need to think about the cost implication too, that it's cheaper for vaccination than to treat the disease. Proactive is better than reactive. There are several vaccination programs that happen and start from an early age. These cover 13 different diseases like polio, measles, rubella, mumps, tetanus and diphtheria. So these diseases can have a fatal outcome if contracted. These programs are normally undertaken by the GP, health visitor or nurse, but they are optional and parents have the right to refuse. The SARS-CoV-2 program to vaccinate everybody worldwide has been a massive achievement around the world. As of the 6th of March, there have been over 140,156,950,000 vaccines given. There was a 91.5% uptake on the first dose, but that was down to 66.5% on the third dose, on the third booster dose in February 2022. There are many factors that can affect the way that a vaccine uptake happens. There are the people that don't believe in the vaccination, full stop, the anti-vaxxers, as they believe do more harm than good. There is the thinking, is this safe to give? When we look at COVID, then people are bored, and a lot do not believe that it's as bad as they thought it was, and the restrictions they've had to live with for the last 2 years have forgotten how bad it was, as new strains are less severe than the original version. We know that the vaccines have a major part to play with the eradication of diseases, and this can be shown as smallpox. It was estimated over 300 million people have died in the 20th century of smallpox. But as of 1980, the World Health Organization declared it was eradicated after a massive vaccination program. Increase in the uptake of all programs when have been made more accessible by out of hours. Apart from doctor surgery, the pharmacy was also added to increase, so this can be arranged around a patient's life, and that is more possible for them to take part. Thank you very much for listening. This is the end of my presentation.